So hey guys, today we are going to start first chapter of anatomy, which is introduction. So yeah, let's go. The forelimbs and hind limbs were evolved basically for bearing the weight of the body and for locomotion, as is seen in quadrupeds. Quadrupeds like which contain 4 legs, 4 limbs. Example, cows and dogs. The two pair of limbs are therefore built on the same basic principle. So yeah, we are just evolution. Human is just evolution of monkey. So they are comparing with animals like they also have 4 limbs. They are quadrupeds, but our upper limb is converted into different form for use of different skills like writing and everything like daily we do. Now each limb is made up of a basal segment or girdle and a free part divided into proximal, middle and distal segment. The girdle attaches the limb to the axial skeleton. The distal segment carries 5 digits like fingers we have. Okay, digits means fingers here. However, with the evolution of erect posture in man, the function of weight bearing was taken over by the lower limbs. Thus, the upper limb, especially the hands, become free and gradually evolved into organs having great manipulative skills. Yeah, just we discussed about that. Now, the weight bearing of body is only there in the lower limbs. In animals, we were having weight bearing on 4 limbs as we discussed in first paragraph. So, upper limb is mainly used for manipulative skills. Now, this has become possible because of wide range of mobility at the shoulder. We have huge amount of mobility at the shoulder. Though there are many structures which stabilize the shoulder and prevent for disarrangement, dislocations, subluxations. The new words we are going to learn in upcoming lectures. So the whole upper limb works as a jointed lever. If one joint is moving, other will move. So yeah, the human hand is grasping tool. It is exquisitely adaptable to perform various complex functions under the control of large area of brain. Like yeah, brain is everything that is ordering, like hand you need to do this, like brain is central. The unique position of man as a master mechanic of the animal world is because of the skilled movements. Yeah, the reason human is more advanced than any other animal is because of they have hands. They can do many skilled works with their hands. So now it's compared. The table is of comparison, like upper limb there is shoulder girdle, in lower limb there is hip girdle. Girdle is the socket, like the shoulder joint, hip joint in lower limb. Arms in the humerus. So this is the arm, okay, with the humerus bone. Arm area with humerus bone. In lower limb there is thigh with femur, similar structure. Then there is elbow joint. In lower limb knee joint. Forearm with radius and ulna. Leg with tibia and fibula. Radius, ulna. These are the bones, okay? These are bones. These are all bones. These are all area which it covers. Ankle joint, wrist joint, ankle joint. Hand with carpus, metacarpus 5 digits. Foot with tarsus, metatarsus and 5 digits. So yeah, these all are bones we are going to learn. Parts of upper limb. It has been seen that the upper limb is made up of 4 parts. Shoulder girdle, arm or brachium. The arm or its synonym. Forearm or antebrachium. Hand or manus. Okay. So this can be used. The synonyms can be used in your MCQ entrance. So yeah, do remember it once, like okay. Then here is the shoulder joint, shoulder girdle. This is the clavicle bone which attaches the upper limb with the axial skeleton, appendicular skeleton and axial skeleton. Then there is scapula, wing bone at the back. Then where we have arm. In arm we have bone which is humerus, long bone. Then we have elbow joint. We have ulna bone, radius bone. Radius bone is over the thumb aspect. Okay, wherever is the thumb, radius is there, which is present in forearm. Okay, radius ulna are present in forearm. Then we have wrist joint. Then we have carpal bones, 8 carpal bones in the wrist joint. Then we have hand. The other name was manus. Okay, we did it here. Now we have metacarpal bones and phalanges, the digits, which is 14 phalanges in each hand. So today total 32 bones of upper limb in each upper limb. Yeah, so parts of upper limb, the table is you need to go through once, but once we complete whole anatomical part, it would be all on your tip of tongues. So in shoulder region we have pectoral region on the front of the chest, axilla or armpit, scapular region on the back. We talked like here we talked scapular bone at the back, wing bone. Now bones of the shoulder girdle are clavicle and scapula, and joints are sternoclavicular and acromioclavicular. We need to discuss it next upcoming lectures. Now second is upper arm or brachium from shoulder to the elbow, which contains, it has no subdivisions, it is one segment, complete segment. Okay, now we have humerus in the bone and shoulder joint, scapulohumeral joint. Forearm. Now next is forearm from elbow to wrist, no subdivisions again, radius and ulna bones, elbow joint, radio ulnar joint. We will discuss hand, wrist, proper hand and 5 digits, which is made up of phalanx. We saw phalanges. Carpus made up of 5 metacarpal bones, 14 phalanges, 2 for the thumb and 3 for each of the 4 rings. Then wrist joint, intercarpal joint, carpometacarpal joint, intermetacarpal joint, metacarpophalangeal joint, proximal and distal interphalangeal joints. So yeah, the whole table is discussed here in more detail. Though any questions won't come from this, but we will just, it's for introduction, is for knowledge, like this gonna be what you are going to study. Okay, now first, the shoulder region includes the pectoral or breast region on the front of the chest, the axilla or armpit, the scapular region on the back comprising parts around the scapula. The bones of the shoulder girdle are clavicle and scapula. Of this, only the clavicle articulates with the axial skeleton at the sternoclavicular joint. Only clavicle articulates with the axial skeleton, which we know it connects both axial and appendicular skeleton. The scapula is mobile and is held in position by muscles. The clavicle and scapula articulate with each other at the acromioclavicular joint. The arm, upper arm or brachium, extends from the shoulder to the elbow. Elbow is also known as cubitus, which contains cubital fossa. Elbow contains cubital fossa. Okay, let's go more detail in the next lectures. The bone of the arm is the humerus. Its upper end meets the scapula and forms the shoulder joint. The shoulder joint permits movement of the arm. Okay, the arm movements occurs at the shoulder joint. Arm will move at the shoulder joint, proximal joint. So next, the forearm, which is also known as antebrachium, extends from elbow to the wrist. The bones of the forearm are the radius and ulna. At the upper end, they meet the lower end of the humerus to form the elbow joint. The lower ends meet the carpal bones to form the wrist joint. The radius and ulna meet each other at the radio-ulnar joint. So yeah, it's the words explains everything. The elbow joint permits movement of the forearm, namely flexion, extension. Two movements are possible at the elbow, flexion and extension only. The radio-ulnar joint permits rotatory movements of the forearm, also called as pronation and supination. It occurs at radiocarpal joint, not at elbow joint. Kindly note this. In a mid-flexed elbow, the palm faces to upwards in supination and downwards in pronation. During the movement of pronation, the radius rotates around the ulva. During pronation, radius rotates. Ulna stays at the place. No movement. Okay, so yeah. Next we go to hand. Hand includes wrist or carpus, supported by 8 carpal bones arranged in 2 rows. The hand proper or metacarpus supported by 5 metacarpal bones, 5 digits, thumb and 4 fingers. Each finger is supported by 3 phalanges, but the thumb has only 2 phalanges, there being 14 phalanges in all. The carpal bone from the wrist joint with the radius intercarpal joint with another and carpometacarpal joint with the phalanges. The phalanges form carpometacarpal joint with the carpals and interphalangeal joint with the another. Movement of hand are permitted chiefly at the wrist joint. The thumb moves at the first carpometacarpal joint, whereas exclusive movement of opposition besides the other usual movement is permitted. Each of the second or to fifth digits move at metacarpophalangeal, proximal and distal interphalangeal joints. Evolution of upper limbs. So yeah, how it's evolved. The forelimbs have evolved from pectoral fins of fishes. Yeah. If we go into Hindu mythology, it is known as we all evolved from fishes, like first life came from water. So yeah, the tetrapods, all the 4 limbs are usually used for supporting body weight and for locomotion. In arboreal, tree dwelling, the animals which live on tree is known as arboreal, like monkey and all. Human ancestors, the 4 limbs have been set free from their weight-bearing functions. The 4 limbs thus emancipated acquired a wide range of mobility and were used for prehension, grasping, feeling, picking, holding, sorting, breaking, fighting, etc. and many skills, manipulative skills. This function became more possible only after the necessary structural modifications. Appearance of joint permitting rotatory movements of the forearm, described as supination pronation, which was occurring at radio-ulnar joint, as a result of which food could be picked up and taken to the mouth. So yeah, here is where the daily activities are combined with the anatomy. It's all amazing, like how we are all evolved from small living. It's not about studying, we should know about how our body is formed and all. So yeah, addition of the clavicle, which has evolved with the function of prehension. Prehension is like grasping. Rotation of thumb through 90 degrees so that it can be opposed to other digits for grasping. Like in monkeys, it was not possible. Opposition means touching thumb and little or other fingers tip. So yeah, they are not able to hold something cylindrical or anything like that. They used to, that hand used to work as one object, one joint. Then appropriate changes for free mobility of the fingers and hand. The primitive pentadactyl limbs of amphibia. Penta means 5. Dactyl means fingers. Terminating in 5 digits has persisted through evolution and is seen in man. In some other species, however, the limbs were altogether lost, as in snakes, and the digits were reduced in number, as in ungulates. No digits or reduced digits. The habit of brachiation, that is suspending the body by the arm in anthropoid apes, resulted in disproportionate lengthening of the forearms and also in elongation of palm and feet. Like, yeah, if the hands or anything is like hanging, some kind of traction force will be there due to gravity. A gravity pull will be there towards downside, so the elongation will take place of the limbs. This is the thing you need to remember. Then study of anatomy. Before studying the anatomy of any region, it is usual to begin by learning general features of skin, superficial fascia and its contents, the deep fascia, bones, muscle, joint, blood vessel and nerve. So yeah, these are all the layers of human structure. All these are provided in BDC Handbook of General Anatomy, 6th edition, any edition. This is followed by the study of muscles of region and finally the blood vessels and nerves. This description should be read only after the part has been dissected with the help of steps of dissection provided in the book. So it's all about the practical things. If we connect theory with practical, life goes easy. Before undertaking the study of any part of the body, it is essential for the students to acquire some knowledge of the bones of the region. It is for this reason that a chapter on bones, osteology, is given at the beginning of each session. While reading the chapter, the student should palpate the various parts of bones on themselves. So you can feel, yeah, this part is here, this you need to connect all the things. The next chapter must be studied with the help of loose human bones. So yeah, that's where you need to get the skeletal bones in your hand. You need to palpate the grooves and the landmarks of the bone. But yeah, we will connect the theory with the practical things. So here is the end of the first chapter. We will continue this. Okay, this is like line of force transmission. Like force or weight is beared on the hand, it goes to wrist, then radius, then interosseous membrane is present between radius and ulna, along which supination pronation takes place, which transmits the weight to ulna, which goes to elbow joint, then humerus, then shoulder joint, then scapula. Scapula transmits it to coraco, which is part of scapula, clavicular ligament to clavicle. Then it will be transmitted through sternum clavicular joint to sternum. which will transmitted to axial skeleton, which is our trunk. From there, lower limb. So yeah, so make a flowchart to show lines of force, which is shown here, we discussed here. Okay, tabulate the homologous parts of upper. Okay, that too is given. These are the homologous parts we discussed already. Then enumerate subdivisions of shoulder region, joints related to forearm, name of the carpal bones in order. Okay, this is like I have one trick. We will start from thumb side. Okay, now proximal to distal, we have 8 bones. 1 2 3 4, 1 2 3 4. Okay, then here she looks too pretty, try to catch her. Okay, so this is the mnemonics through which we can remember the carpal bones. Is it okay? Scaphoid, lunate, triquintral, pisiform, trapezoid, trapezium, capitate, and hamate. So yeah, if it's like mnemonics, we gonna discuss in the upcoming chapters. It's not given in this chapter and they have asked, but yeah, this is the mnemonic we will learn. And joints of the hand. Joints are everything that is asked in the last question is given in this whole table. Everything was about the table, and as we know, we need to describe everything in our paper, which is like describing. We are not supposed to write in whole paragraphs and all. We just need to describe it in figures, tables, charts, and easiest possible way to the examiner, because they won't be having much time to just look at your paper and read it each and every word of it. So yeah, it should be presentable and just one view the answer should be checked. So yeah, that's how you should be learning. And each and every questions here are asked from flow charts. Okay, which you need to note. So yeah, that's all today. We are ending up with this chapter and this session. Please go through it, and if any doubt, please do comment in the comment section. I will be answering as soon as possible, and we are meeting in next chapter in the next episode. So thank you. Do like, share, and subscribe to my channel. Stay connected.